بسم الله الرحمن الرحيم. هنكمل المحاضرة الثانية للريستنج ممبرين بوتنشال. Contents of the lecture: type of membrane potential, resting membrane potential, calculation of resting membrane potential by Goldman equation, causes of resting membrane potential, role of sodium potassium pump in resting membrane potential. Learning outcomes: the student should know the types of membrane potential, the normal concentration of ion in extracellular fluid and intracellular fluid, define resting membrane potential, normal values of resting membrane potential in nerves and muscles, the causes of resting membrane potential in nerve and muscle, the role of potassium in diffusion in resting membrane potential, the role of sodium potassium pump in resting membrane potential. Case scenario: 30 years old man suffers from a cut wound in arm. He goes to the hospital. He needs 3 stitches to help in repair of the wound. The doctor sprays the wound with ethyl chloride to relieve pain during this minor surgical procedure. This is the wound, and it needs 3 stitches in the wound, so spray ethyl alcohol which cools the skin around the wound. Cooling decreases the metabolic reactions inside the nerve fiber, leading to decrease the ATP needed for sodium potassium pump. Sodium will go inside, decrease resting membrane potential, and lastly decrease the excitability and produce nerve block and relief pain. Also, ethyl alcohol is used for temporary relief of pain from sports injuries and helps to relieve deep muscle pain when used with muscle stretching techniques. Types of membrane potential. Resting membrane potential is the potential difference between outside and inside of nerve fiber during rest. It is negative because the inner surface of the cell membrane is negatively charged relative to the interstitial fluid. Types of membrane potential. Resting membrane potential, it varies according to excitable tissues. In nerves it equal minus 70 millivolts, skeletal muscle minus 90 millivolt, cardiac muscle minus 90 millivolts, smooth muscle minus 60 millivolt. The second type of membrane potential is graded potential, which is a local change in resting membrane potential as a result of stimulation by an effective stimulus. This is a graded potential. It does not reach the firing level, which produce an action potential. This is a graded potential. Types of membrane potential. Graded potential, the duration and the magnitude of these potential are variable according to the stimulus. Subthreshold stimulus produce a small local response or small graded potential. When the stimulus reaches the threshold, it produces the action potential. The suprathreshold also produces an action potential because it reaches the firing level. Graded potential. Examples of graded potential: receptor potential in beginning of sensory nerves, synaptic potential in synapses inside CNS, pacemaker potential in the heart, miniature in the play potential at neuromuscular junction, local excitatory state at cell bodies of neuron. Action potential is the electrical changes which occur in resting membrane potential as a result of stimulation by effective stimulus. These changes propagate along the nerve fiber and produce response or action. This is action potential. This is a rest, and this is a stimulus, the effective stimulus that reach the rest firing level, producing an action potential. After it ends, it returns to the resting state again. Resting membrane potential. Resting membrane potential is measured by 2 microelectrodes with very fine tips less than 1 micrometer connected with a special volumeter. This is a special volumeter, and this is 2 microelectrodes. One is inserted in the outside the cell, extracellular fluid, which is the reference electrode, and one is inside the cell, which is the recording microelectrode. And these measure the difference between in potential between inside and outside the cell. Calculation of resting membrane potential by Goldman-Hodgkin-Katz equation, which says that resting membrane potential equal minus 60 log P P EM with membrane potential. B refers to permeability of the membrane to ion. In concentration of the ion inside the cell, out concentration of the ion outside the cell. So membrane potential equal minus 60 log P potassium by potassium concentration inside plus P sodium by sodium concentration inside plus P chloride by chloride concentration outside. All this divided by B potassium by potassium concentration outside plus P sodium by potassium concentration outside plus P chloride by chloride concentration inside. Causes of resting membrane potential: distribution of ion, selective permeability, sodium potassium bond. Distribution of ions inside the cell. As we said in the first lecture, sodium concentration outside 140 milliequivalent per liter, inside 14 milliequivalent per liter. Chloride outside 100 milliequivalent per liter, inside 4 milliequivalent per liter. And potassium outside 4 milliequivalent per liter, inside 140 milliequivalent per liter. Protein inside 16 gram percent, outside 2 gram percent. So extracellular to intracellular fluid ratio for sodium ion is 10 to 1. Extracellular to intracellular fluid ratio for potassium ion is 1 to 35. Extracellular to intracellular fluid ratio for chloride is 25 to 1. And again, the same distribution of ions through the cell membrane for potassium, protein, sodium, and chloride. The second cause of resting membrane potential is selective permeability of the cell membrane. The cell membrane contains ion channel, allow only specific ion to pass while blocking others because of their size, charge, or state of hydration. The ions pass through ion channel in the cell membrane, which may be leakage passive channel, voltage gated channel, or chemically activated ion channel. Cell membrane offer absolute barrier to protein in resting neuron. Potassium ion pass through passive ion channel with difficulty. Sodium ion pass through passive sodium channels with difficulty. Potassium pass through passive potassium channel more easily. The cell membrane is about 100 times more permeable for potassium than for sodium ions. Potassium diffusion, the main cause of resting membrane potential. Potassium diffuse from inside the cell to outside due to concentration gradient inside 30 to 40 times more than outside. High permeability of the membrane to potassium ion, 100 times more than sodium. Protein ion tend to diffuse outside with potassium, but the membrane is impermeable for them, so protein ion with negative charges are held on the inner surface of the membrane. Here, protein are held on the inner surface to the membrane because of this large molecular weight cannot pass through the cell membrane. Diffusion of potassium and protein. Potassium pass easily due to the concentration gradient inside more than outside, and the high permeability of the cell membrane to potassium. Protein tend to move outside, but it cannot move due to its large molecular size, so it is held on the inner surface of the membrane. Here, this demonstrates the diffusion. While protein tend to diffuse, it cannot diffuse due to the large molecular weight, and this is responsible to the positive charges. Potassium outflux is responsible for the positive charges outside the cell and the negative charges inside the cell. Again, potassium efflux, outflux, protein held on the inner surface of the membrane. Outside is positive and inside is negative. Sodium ion tends to diffuse from outside to inside due to concentration gradient. Outside more than inside 10 times. Electric gradient inside is negative. Chloride tends to diffuse from outside to inside due to concentration gradient. Outside more than inside by 25 times. The diffusion is prevented by repulsion force by negative charges inside the cell produced by protein. The third cause of sodium-potassium bump is of resting membrane potential is sodium-potassium bump. Here, potassium diffusion, as we said previously, potassium diffusion through the leakage channel from inside to the outside, from intercellular space to extracellular space. And this is a sodium diffusion from extracellular space to intracellular space by the concentration gradient and by the electric gradient. And the sodium-potassium bump transmits the sodium from outside, return it again to outside, and potassium from outside, return it again into inside. Sodium-potassium ATPase bump 3 sodium ion outside the cell and 2 potassium ion inside the cell to maintain a high concentration of sodium ion outside and a high concentration of potassium ion inside nerve cell. This occurs in spite of the continuous diffusion of these ions across the membrane. Sodium-potassium bump has ATPase property, has ability to split ATP, 3 sodium binding site at intracellular fluid site, 2 potassium binding site at extracellular site, ATP binding site at intracellular site. Here the sodium-potassium bump, it has 2 binding sites for potassium on the inner surface and 3 binding site for sodium in the outer surface and an ATP binding site in the inner surface. So it is need energy, this pump need energy from ATP to transmit 2 potassium molecule from outside to inside and 3 sodium molecule from inside to outside. Any condition decreases the metabolic activity of the cell by cooling, inhibits sodium-potassium bump. So sodium ions will accumulate inside the cell and neutralize the negative charges of protein ions. Potassium ions that held on the outer surface escape away and the resting membrane potential become progressively lost. And the end of the lecture.